My name is Andrew Healey. I'm a consultant HPB surgeon at the Royal Infirmary of Edinburgh. I also perform endoscopy and I'm interested in endoscopic ultrasound. I think when I first decided to become a doctor, it was a long time ago. I was 18, and I was interested in sort of biology, particularly in the human body, but also had quite a strong influence from my father, who was a GP, and he used to come home with really sort of uplifting stories about patients he'd treated, people he'd worked with. And I thought, yeah, I can see how he's still enjoying his job when he's in his 40s, 50s back then. And I thought, yeah, maybe I could do that. So I liked the science, I liked the study, and I liked the fact of being still interested in what you do and on a day-to-day basis, well into my 50s and 60s. And I thought, yeah, that's something I could do. So I chose HPV surgery towards the end of my basic surgical training. I had a combination of factors. I found liver surgery fascinating because of the number of ways you can manipulate the liver to try and overcome cancer, or often metastases to the liver. And I thought that was absolutely fascinating. And then I also found the study of the pancreas very interesting because it's so inaccessible, and the nature of the surgery is so radical. So the combination of pancreas surgery and liver surgery put together, I thought this is my specialty, and so I went for that. I also had an encouraging boss at the time, and I had research options available, and I thought this is the stars are aligning, and I thought I'll go with this, and I've never regretted it. I still enjoy it. The most rewarding thing is I enjoy the people I work with. I enjoy the patients I meet. I enjoy what I get in terms of professional satisfaction from my work on a day-to-day basis. I love the variety of both general surgery and specialist cancer HPB surgery. I enjoy the variety of techniques I use: laparoscopic, endoscopy, open surgery. There's never the same day twice, and there's never the same patient or person you're working with, often twice. So it still keeps surprising me and still keeps interesting me, and uh, and that I'm very grateful for, and long may it continue. You're better to ask the patients, I suspect, but I try to speak to every patient in the same fashion, as if I'm really speaking to a relative, trying to break down what I know and my experience of patient management in the past and things I've learned, but also my knowledge of disease and HPB surgery. I try and simplify all the jargon really and try and explain in very simple terms, often some analogies, to try and make what can be very daunting decisions about patients' healthcare more simple, and I try and put myself in the patient's shoes and imagine what they're going through, which can be incredibly traumatic, and just really offer a sounding board for a lot of their decision making, and help in what can be very challenging times, and for what for me is a very privileged position. So just try and be accessible, honest, straight, and treat every patient as if it's a close member of your family.